Throughout history, certain topics have ignited intense debates, challenged societal norms, and reshaped the course of civilizations. From the shadows of ancient conspiracies to the glaring lights of modern controversies, these subjects continue to captivate and divide us. Welcome to the Controversial Corner, where we delve into the heart of these contentious issues, exploring the facts, the myths, and the perspectives that fuel the fires of debate. Join us as we navigate the complex landscapes of lifestyle, science, culture, and beyond, seeking understanding in a world where truth is often elusive. Subscribe now and embark on a journey through the most provocative topics of our time. Health is a topic that impacts every individual, yet it often sparks debates and controversies that are shaped by science, politics, culture, and societal norms. From medical advancements to public health policies, some of the most pivotal moments in health history have sparked widespread debate. Whether it's the ethics of new medical treatments or the challenges surrounding healthcare systems, the world of health has witnessed its share of divisive moments. In this documentary, we explore 10 controversial moments in the history of health that have had lasting effects on how we view healthcare, medical practices, and wellness today. 1. The anti-vaccine movement. The anti-vaccine movement is one of the most controversial health-related issues of the 21st century. Fueled by misinformation, fear, and mistrust of the medical community, the movement has led to a rise in vaccine hesitancy, particularly in Western countries. This controversy reached a boiling point when an infamous 1998 study by Andrew Wakefield falsely linked the MMR, measles, mumps, rubella vaccine to autism. Though the study was later retracted and discredited, its impact has lingered, leading to outbreaks of preventable diseases like measles. The ongoing debate about vaccines, especially during the COVID-19 pandemic, has sparked fierce arguments about public health, personal freedoms, and scientific integrity. 2. The legalization of marijuana. Marijuana, often seen as a recreational drug, has also been touted for its medical benefits, particularly in pain management and treating conditions like epilepsy and chronic pain. However, the debate around its legalization has been deeply controversial. In many countries, including the United States, marijuana remained illegal for decades, despite mounting evidence supporting its therapeutic potential. Proponents argue that legalizing marijuana not only offers patients an alternative to opioid medications but also helps reduce the stigma around medical use. However, critics argue that it could lead to public health issues, such as addiction or impaired driving. The legalization of marijuana has sparked a broader conversation about drug regulation, the role of the government, and its impact on health. 3. The rise of opioid addiction. Opioid addiction has become one of the most devastating public health crises in recent history. It began with the widespread prescribing of opioid painkillers, such as OxyContin, in the late 1990s as pharmaceutical companies marketed these drugs as safe and non-addictive. However, as prescriptions increased, so did addiction rates, leading to a surge in overdose deaths. The controversy over opioid addiction revolves around the role of pharmaceutical companies, doctors, and regulatory agencies in fueling the crisis. Many believe that the pharmaceutical industry's aggressive marketing and failure to warn about addiction risks are partly to blame. The opioid epidemic has led to calls for greater regulation, addiction treatment programs, and improved patient education on pain management. 4. The treatment of mental health disorders. Mental health care has long been a source of controversy, particularly regarding the treatment of conditions like depression, anxiety, and schizophrenia. For much of history, mental illness was misunderstood, leading to practices like institutionalization, electroconvulsive therapy, ECT, and lobotomies. As new medications and therapies emerged, questions about their effectiveness, side effects, and ethical implications became central to the mental health debate. The rise of antidepressants, particularly selective serotonin reuptake inhibitors, SRIs, sparked intense discussion about overprescription and the potential over-medicalization of mental health. Additionally, the stigma surrounding mental illness continues to be a major societal issue, preventing many people from seeking help and care. 5. The obesity epidemic and weight loss industry. Obesity has become a major public health issue worldwide, with millions of people suffering from obesity-related diseases like diabetes, hypertension, and heart disease. The controversy surrounding obesity often revolves around issues of personal responsibility, diet culture, and public health interventions. The weight loss industry, which includes diets, surgery, and weight loss drugs, has generated billions of dollars, but critics argue that many of these approaches are ineffective, unsustainable, and even harmful. Additionally, body shaming and unrealistic beauty standards have contributed to mental health struggles for those affected by obesity. The ongoing debate challenges the intersection of personal health choices, societal expectations, and the larger healthcare system. 6. The controversy over the use of hormonal birth control. Hormonal birth control has been widely used for decades, allowing women to have control over their reproductive health. However, the pill and other forms of contraception have sparked debates surrounding their health risks, ethical implications, and accessibility. Critics argue that hormonal birth control can lead to side effects such as weight gain, depression, and even an increased risk of certain cancers. Others point to the way birth control can be used to control women's reproductive rights and question whether women are given enough information to make informed choices. On the other hand, proponents assert that birth control has empowered women, giving them more autonomy over their health and career choices. The controversy touches on issues of gender equality, autonomy, and the role of the medical system. 7. The role of Big Pharma in healthcare. Pharmaceutical companies, often referred to as Big Pharma, have come under intense scrutiny due to their influence on healthcare practices, drug pricing, and research. Critics argue that many pharmaceutical companies prioritize profit over patient welfare, driving up the cost of essential medications and treatments. High-profile cases like the pricing scandal involving the EpiPen and the price gouging of life-saving drugs have sparked public outrage. Furthermore, there is growing concern about the influence of Big Pharma in medical research, where funding and sponsorship can shape study outcomes or suppress negative findings. The controversy surrounding Big Pharma continues to raise questions about the ethics of drug development, marketing practices, and the accessibility of healthcare. 8. The controversy over genetic testing. Genetic testing has opened up new possibilities in diagnosing and treating diseases, but it has also raised a host of ethical concerns. For instance, companies offering direct-to-consumer genetic tests have sparked debates over the accuracy of results, privacy issues, and the potential for genetic discrimination. Additionally, the ability to identify predispositions to genetic disorders has led to ethical questions about the implications of such knowledge. How should genetic information be handled? Should parents have the right to test their children for genetic conditions before birth? The growing field of genetic testing has challenged our understanding of privacy, genetics, and the role of technology in healthcare. 9. The debate over euthanasia and assisted suicide. Euthanasia and assisted suicide have been contentious topics for decades, as they involve questions of personal autonomy, moral beliefs, and the value of life. Supporters argue that individuals suffering from terminal illnesses should have the right to choose a dignified end to their lives, free from pain and suffering. Opponents, however, argue that legalizing euthanasia could lead to abuses, especially in vulnerable populations, and that it undermines the sanctity of life. The legal battles over euthanasia in countries like the Netherlands, Belgium, and Canada have sparked widespread discussions about the ethics of end-of-life care and the role of medical professionals in assisting death. 10. The COVID-19 pandemic and public health responses. The COVID-19 pandemic became one of the most controversial moments in modern health as governments, health organizations, and individuals disagreed on how best to manage the crisis. From lockdowns to mask mandates, and vaccine distribution to travel restrictions, nearly every aspect of the pandemic was subject to public debate. Some criticized public health responses for being too strict or ineffective, while others argued that they were not strict enough to prevent widespread transmission. The pandemic also highlighted inequalities in healthcare access and exacerbated existing tensions between public health and personal freedoms. The COVID-19 crisis forced the world to reevaluate its approach to global health challenges and the role of governmental intervention in protecting public well-being. The complex nature of health and society. Health is a deeply complex issue, often influenced by science, culture, politics, and personal beliefs. From the rise of chronic diseases to the advancement of medical technologies, the controversial moments we've explored highlight the challenges and conflicts that arise when we try to balance personal freedom, medical ethics, and public health. As we continue to face new health challenges, it's clear that the debates surrounding healthcare, medical treatment, and wellness will continue to shape our society in profound ways. Thank you for watching. If you found this documentary insightful, don't forget to like, share, and subscribe for more content on technology, business, lifestyle, health, society, and global issues. What are your thoughts on these controversial moments? Let us know in the comments below. Stay tuned, and we'll see you in the next video.